It's giving a lot of thought on some new things to talk about, some cutting edge stuff, concepts. We all know the gut to the brain is bi-directional. Whatever you do to your gut, you do to your brain. Whatever you do to your brain, you do to your gut. What about in between that? Now, there's a direct link between the gut and the heart and the brain. So now we'd like to refer to the bi-directional or tri-directional axis as the gut, heart, and brain axis. I'm going to attempt to elucidate emerging research that reveals a sophisticated and dynamic interplay among the gut, heart, and brain. These are three vital systems that were once studied independently, but are now recognized as profoundly interconnected. I do believe the body is all interconnected. In this presentation, I will examine and share the tridirectional communication networks that link the enteric, cardiovascular, and central nervous system through microbial, immune, neuroendocrine, and vagal pathways. I'm going to delve into how the gut microbiota affects systemic inflammation. It affects everything. The gut is the epicenter of your health. So we're going to learn how the gut affects the heart, the gut affects the brain, and what to do. I'm going to share some protocols. It's going to take me about 45 minutes to take you through this little tour of the gut, heart, and brain axis. And at the end, I'm going to be answering any and all of your questions. I've allotted extra time for questions. Please populate them. Caitlin's going to help me with the questions. And let's dig right in. Ocean Robbins once said, when you eat the standard American diet, you get the standard American diseases. Now, that's one heck of an acronym. The acronym is SAD. The standard American diet, nothing's worse than that. So many people come to me and say, hey, what diet is better than the one I'm doing now? Or I got some gut improvement over the diet that I implemented over the one I was doing before. Anything you do is better than the standard American diet. It's ranked dead last for the last 10 years in a row. As I've said before, and I like to say many times, the gut is the epicenter of your health. Whatever you do to your gut, you do to your brain. Whatever you do to your brain, you do to your gut. Whatever you do to your gut, you affect the full body axis. It is your bullseye. 8% of your immune cells are in your gut, where your macro and micronutrients are absorbed. So dysbiosis, the unleveling of good and bad bacteria. How much good bacteria do you need not to have dysbiosis? This may shock many of you. You need about 85% or more good bacteria not to be dysbiotic. So when you're in dysbiosis, you have an increased incidence of heart disease, atherosclerosis, hypertension, obesity, type 2 diabetes, actually type 1 and type 2, and gastrointestinal disorders. So the gut microbiota and the cardiovascular disease, very interesting. Don't want to get too heady. Don't want it to be too much biochemistry. But something called LPS, lipopolysaccharide, which holds gram-negative bacteria on the inside of the intestinal wall. It's an endotoxin. When that's expressed, it stimulates toll-like receptor 4. That toll-like receptor 4 cascades and stimulates oxidative stress and a lot of cardiovascular disease because cholesterol accumulation, inflammation is also risen. So cholesterol is an interesting thing in that cholesterol is not a problem. It only becomes a problem when the body's inflamed. Cholesterol is a Band-Aid. It's a Band-Aid to inflammation or injury. No inflammation or minimal inflammation, no injury. Cholesterol doesn't pose an issue. So let's look at the mechanisms of gut permeability or mediated low-grade endotoxemia. So here you see the tight junctions, and they should stay tight. And what's interesting about the tight junction is that the tight junction is the key to overall health. So the gut epithelial barrier consists of basically an epithelial cell. Together they make a tight junction. The tight junctions pull apart when zonulin is increased, and they make the tight junctions a looser junctions. Things that pass the gut at that point that shouldn't pass are proteins, bacteria, parasites, and the like. So here's an interplay between low-grade endotoxemia and vascular disease. What you're really seeing is the gut dysbiosis leading to a leaky gut, cascading to the activation of toll-like receptor 4 once again, increasing inflammation, atherosclerotic plaque, clotting, and thrombosis. formulation. So the gut is really one of the Darth Vaders, if you will, behind the curtain for a lot of your cardiovascular injuries. Unfortunately, modern medicine or modern cardiological medicine, even though we're taking all this information from their periodicals, 2023, 2024, 2025, hasn't really caught up to the concept that the gut is the key. There is a government paper that just came out this morning with some suggestions, and in those suggestions, it was that the gut microbiome should be a mainstay, all doctors, and should be discussed and examined. So here are some mechanisms LPS adversely affecting, once again, atherosclerosis. So there are three mechanisms responsible for bacterial translocation, the systemic inflammation. Number one, altered gut function. Number two, bacterial overgrowth, something like a small intestinal bacterial overgrowth or an impaired host defense. This all leads to bacterial translocation. Bacterial translocation refers to the idea of the bacteria that's supposed to be inside the gut has gotten through the gut and got into the bloodstream. So once it's inside the gut, it's performing its needed properties. When it gets outside the gut and gets into the bloodstream, it stimulates an immune response, which starts a localized inflammatory response, which can lead to a systemic inflammatory response and ultimately lead to any kind of autoimmunity, because of the overstressing of the immune system leads to its aberrancy. This bacterial translocation actually can also imply that there's a bacteria endotoxin entering the blood, i.e. lipopolysaccharides, LPS, leading to an activation of monocytes, macrophages, and the release of pro-inflammatory mediators. So there's a lot going on here. Essentially, the gut can cause type 1 diabetes, rheumatoid arthritis, eczema, asthma, IBD, IBS, type 2 diabetes, and the like. But the big takeaway here is the association of the gut microbiome and cardiovascular disease. The heart and the gut are directly linked. Interestingly enough, patients with inflammatory bowel disease appear to have a higher risk for coronary heart disease, despite a lower prevalence of classic risk factors, indicating additional links between the gut and the heart. So here we are in 2014, 11 years ago, European Heart Journal speaking about a direct correlation between the heart and the gut. So let's talk about some triggers of gut permeability. We all know that one of the big triggers is antibiotics. I'm not anti-antibiotic. I don't mean to sound like that's a misnomer. Antibiotics destroy all bacteria, both good and bad. You'll never have the same ecosystem after a dose of antibiotics. So clearly, the usage of antibiotics, though needed, has its place. And in any case, once consuming the antibiotic, you will have probably a case of dysbiosis. The one that really bothers me is the acid-blocking drugs, the proton pump inhibitors, because most people don't have enough acid. So it almost doesn't make sense to use acid-blocking drugs. And drugs should be taken for 4 to 6 weeks. They're usually taken for months, years. I have patients that are taken for even decades. The increased usage of acid-blocking drugs increase the incidence of leaky gut and damages the blood-brain barrier. NSAIDs, non-steroid anti-inflammatories. They do it lead, Advil, ibuprofen. They pain, but they decrease healing. Nutraceuticals decrease pain and promote healing. Which do you prefer? Heavy metal exposure, environmental toxins are critical adds. These environmental toxins lead you down the path of Parkinson's disease. Most neurodegenerative diseases, as an aside, usually have an origin of a gut injury. Concussion. 6 out of 10 people that have a concussion have a gut problem. So they either have leaky gut or small intestinal bacterial overgrowth. Liver toxicity. Whatever you do to your gut, you do to your liver. Whatever you do to your liver, you do to your gut. 75% of the toxins that are released through your gut get to your liver via the bloodstream. 25% go from the liver via the portal vein to the gut. Gut dysbiosis, that unleavening of good and bad bacteria, and food sensitivities. Make note, food sensitivities are critical in that I believe they are the reason for chronic hidden inflammation. They are not food allergies. Food allergies are IgE-mediated response. They're immediate. You would know if you have food allergy. If you're allergic to peanuts, shellfish, things like that, you get an immediate response. Food sensitivity is an IgG response, which enables you to consume a food on day one and not see any kind of symptomology for a 72-hour, 3-day period. So how if today is Wednesday, would I know what I ate on Sunday increased my inflammation? How would I know as a practitioner what the patient ate 3 days ago would increase their inflammation or their symptomology? It really begs the question of testing and not guessing. Yeast and bacterial overgrowth, candida is very arduous and it's also very deleterious. Chronic stress, sleep deprivation, chronic inflammation. I think that's one of the biggest things. Well, a hallmark of aging is chronic inflammation. We clearly need to decrease our amount of alcohol. I am a big believer in gluten-free and dairy-free. Don't use any added sugar. Limit your artificial sweeteners. And also, I believe testing food sensitivities. Those who have seen me lecture, have seen me go through this slide. We could spend a great amount of time on this slide. I'm just going to give you the brief overview. Food sensitivities, overgrowth of yeast, unleaveling of good and bad bacteria, dysbiosis can lead you down a path of leaky gut syndrome. If you've got leaky gut, you're going to have liver dysfunction because of extra toxic and chemical overload. In addition, you'll have blood sugar problems, insulin resistance, prediabetes, and diabetes. You'll also have a higher incidence of obesity. One of the big things that you'll see with leaky gut is an increase in autoimmune conditions like thyroid, Hashimoto's disease. 75% of my thyroid patients have a leaky gut. I am a chiropractor. Keelan told you that. My doctorate's in chiropractic. I'm a big believer in musculoskeletal systems. I do believe strongly in a gut to disc axis and a gut to joint axis. This slide really shows that the cytokines from the gut, when it's permeable or excessively permeable, leads to an increase in arthritis and joint pain. Also, leaky gut releases something called MMPSs, matrix metalloproteinases. Your body's own proteolytic enzymes released at the time of injury that will eat fibrocartilage, which makes up your intervertebral disc. There's your gut to disc axis. And in addition to that, not only your gut to disc axis, but your gut to knee axis, because your meniscus is made up of fibrocartilage. And of course, whatever you do to your gut, as I said before, brain, whatever you do to brain, duty. And last but not least, the release of lipopolysaccharide increases the incidence of cardiovascular disease by 3 times. The expression of LPS in your bloodstream increases the incidence of cardiovascular disease by 3 times. There is your memo, and there is your huge Monday morning takeaway. So as you can see, the comparison between a healthy and a leaky gut, all good things occur when you have a healthy, normal intestinal permeability. Leaky gut definitely leads you down a path, slippery slope, towards endotoxemia. The gut to brain connection, let's all get to the root cause of the broken brain. I had a couple of patients, again, one with a concussion today, one with Alzheimer's, and they were astonished that not only did I address the brain, but I also addressed the gut. So when you look at the gut to brain axis based on gut dysbiosis, you can see all these different neurological dysfunctions: depression, anxiety, bipolar, autism. 90% of people that have autism have a gut issue. Alzheimer's, Parkinson's, both have origins in the gut. Dementia, multiple sclerosis is started by a bacterial issue in the gut, and of course, epilepsy. So let's get into the idea of food sensitivities. Food sensitivity is an IgG response. It's you testing for IgG, you're testing for an antibody. It is an inflammation response that we're looking for, not an exposure response. When you're testing for food sensitivities, you should be testing for not exposure. You should be testing for inflammation. That's why we call it a food inflammation test. You should be testing IgG, you should be testing for C3d. But to get back to the IgG, IgG has 4 subtypes, 1, 2, 3, and you should be testing for all 4. Many companies, unfortunately, only test for IgG. IgG enables you to test for a stable inflammatory molecule called C3D. By testing for C3D, you're now not only testing for antibodies, you're also testing for inflammation, accessing what we call the complement cascade, which is part of your innate immune system. So it's a dual pathway that you're testing for. IgG is an adaptive immune system. It's an antibody. You're also enabling yourself to test for inflammation. Now, interestingly enough, before I began really getting involved with sensitivity tests, I never realized that antibodies, many antibodies, can stimulate inflammation. Another good takeaway. So the FIT inflammation test, 176, tests, and it shows it's a patented test. It's the only test that shows an on-sensitivity looking for inflammation because it's testing both pathways, both the adaptive through IgG and through the C complement cascade. I am not going to go through this whole slide. I'm just going to say foods and additives enter the gut. They stimulate inflammation because immune complex formation leads to deposition tissues, which lead to the complement activation, which lead to inflammation, which ultimately lead to symptomology. So the complement system, it is an evolutionary part of the human immune system. It consists of a family of proteins, including C3. C3D is the most inflammatory, stable molecule in the body. This complementary system is part of the innate immune system. Maximum complement activation is achieved during pathogen recognition, leading to a pro-inflammatory milieu inside your body. C3D levels are significantly higher in people that have acute myocardial infarction. The increase in those levels in MI patients occurred previously to classic markers of myocardial damage. Therefore, testing for C3D, you are a candidate for an early biomarker for myocardial infarction. So by utilizing a food inflammation test via food sensitivities, you're really using cardiac markers and ones that should be used as a baseline in everybody's office as far as I'm concerned. So IgG antibodies are power effector molecules that can mediate tissue inflammation by complement activation. So food sensitivities have a positive effect or a negative effect on health. They obviously have a negative effect. They have a systemic inflammatory response. They increase inflammation. They cause skin reactions. The skin is a very unique telltale sign part of the immune system. Food sensitivities, as I said before, lead to joint pain, increased muscle pain and tightness, lead to gas and bloating, which are gastrointestinal symptoms, brain fog, anxiety, depression, and mood. Interestingly enough, anxiety, depression, and mood, these mental health symptomologies, if you remove food sensitivities in an IRB study, you'll find the first set of symptomologies that abate the anxiety, depression, and mood. The second one will be, believe it or not, gas and bloating, fog. Food sensitivity's effect on health leads you down a path of neurodegeneration, autoimmune issues, fatigue, body composition issues, cardiovascular issues, and GLP-1 dysfunction. So I didn't want to go too much into that. I've previously done a webinar on that, but food sensitivities damaging the gut lead you to GLP-1. Also, food sensitivities may significantly increase the risk for cardiovascular disease. People with food sensitivities were shown to have significantly higher risk of CVD. Experts agree unanimously virtually. Changes in the gut microbiome from food sensitivities can affect a person's cardiovascular system. So what does a patient report look like? And why do I like this FIT 176 test so much? I like it because it's color coordinated. It's easy for me to understand. The colors become quite evocative for the patients. So you can see a +4, highest inflammation is red. What does red mean to everybody? Stop. No more. Really no more for a while. One little aside. You take out food sensitivities and foods that raise your sensitivity level of inflammation for approximately up to 3 months. So if it's red +4, stop it. Orange, almost red, +3. Stop. Yellow, slow it down, +2. And green means keep going forward. So it's very easy for everybody to understand which foods to eat and which foods to avoid for a period of time. And then it's also testing for additives. So I always like to tell everybody, test, not guess. How am I supposed to know if it takes you 3 days for inflammation and symptomology to come out after you consume a food, that food's raising inflammation? I can't. It really just exemplary to the idea of you have to test and not guess. So why would we test for increased intestinal permeability? It's a rhetorical question in that I believe that testing for increased intestinal permeability is a baseline test. Actual leaky gut report improves patient compliance and motivation. So it's a baseline. Having over 26 years of practice experience, one of the things I've noticed is sometimes the structure of the leaky gut heals quicker, but most of the time it's function. If function heals, a lot of the symptomology goes away. If that's the case, the symptomology goes away and they don't feel the gas and bloating and the inflammation, they don't feel it. They think they're healed, but their intrinsic gate between health and unhealth, your gut isn't fully knitted yet. So the bottom line is that you want to have a baseline. So you want to test, treat, and reassess. Because sometimes structure and function don't follow in order. So when does a provider want to order the gut barrier panel test? If you want to test and see if you have food sensitivities, because you really don't know, is it food sensitivities or leaky gut? Is it leaky gut or food sensitivities? Which came first? IBS and IBD, you want to test for gut barrier panel integrity. Celiac disease, small intestinal bacterial overgrowth. Leaky gut doesn't cause SIBO. SIBO does cause leaky gut. Post-concussion, as I said before, 6 out of 10 patients that have a concussion either have small intestinal bacterial overgrowth or leaky gut. Digestive and skin issues really imply there's something going wrong inside the body. Weight loss or weight gain, autoimmune conditions, joint and disc injuries, brain fog, fatigue, neurodegenerative diseases, autism, liver dysfunction, blood sugar issues, cardiovascular concerns, clearly. So let's take a look at the gut barrier panel. Let's look at candidas and yeast. Everybody has a certain amount of it. It's when candida is in an overabundance, it can pose a lot of issues. Believe it or not, candida is actually encased by a biofilm, so it's quite protected. If you have a candida overgrowth, you have something called CFO, small intestinal fungal overgrowth. The protein enzyme that was found by Alessio in the year 2000. Let's do zonulin and occludin together. Here's an epithelius. Here's an epithelius. Together they make a tight junction. Zonulin is a functional pull because it's a protein enzyme that pulls apart the tight junctions. So the tight junctions get to loose junctions or looser junctions. Occludin are my fingers. It's the structure that's torn. Once again, zonulin is the protein enzyme that has the pull on the tight junctions. Occludin is present when zonulin is present because of a structural compromise. LPS, lipopolysaccharide, nicknamed El Diablo. You don't speak Spanish, it's devil. It's the last thing I want floating around. LPS holds gram-negative bacteria on the inside of the intestinal wall. When LPS is expressed, it can have a direct binding to structures like your disc, your brain, testes, ovaries, and the like. LPS being expressed also means that gram-negative bacteria is expressed. Gram-negative bacteria, 80% of which is pathogenic bacteria. Let's get to the right side. The right side talks about IgA, or if you will, secretory IgA. Secretory IgA is released at the time that the mucous membrane is injured, nose, lung, and most predominantly here, the gut. IgG and C3D happens over a duration of time. IgA means it happens early onset. IgG and C3D means inflammation was raised over a duration of time. So that said, obviously this person has a candida problem both at the gut lining and over a duration of time. Zonulin has just been compromised. Gluten hasn't been compromised yet. And LPS has been floating around in the gut, causing inflammation to accrue for a period of time. Now, what I like most about the test is the new ad about the cutoff number. So you see that there's a line, and once you go all line, it shows you either positive, the red, or if you're before the line, you're negative. Everybody make note of the first column of IgG-C3D, zonulin, is negative. However, for me, it's so close to the line and it's positive that I'm going to treat zonulin as if that is a positive, and I'm going to treat it for a longer period of time. Candida is a yeast that normally lies in small amounts in different parts of the body. As I said before, mouth, skin, gut. When the environment is right, yeast can multiply and grow out of control. When bacteria is suppressed or the immune system is weakened. So here's a great picture that really shows the idea of occluded zonulin. You're seeing the difference in that the zonulin holds the occluded tight. When the zonulin weakens, the occluded structure can be compromised. So the protein in gluten and intestinal bacteria are the main releases for zonulin, or excessive releases. Zonulin is a protein that's synthesized in the intestinal and liver cells. It's a key biomarker for intestinal permeability, only reversible regulator of intestinal permeability. Elevated levels of zonulin are associated with obesity, celiac disease, autoimmune disease, inflammatory bowel, rheumatoid arthritis, multiple sclerosis, type 1 diabetes. As we segue into the next slide, and higher levels of zonulin are associated with high waist circumference, diastolic blood pressure, fasting glucose, and increased risk of metabolic disease. I believe that zonulin is an everyday marker. It should be tested almost to the amount of frequency that you would test fasting glucose, because all that it reveals is it's elevated. But what's most interesting is if zonulin is increased, occludin typically follows. Occludin is a key biomarker for intestinal permeability. It opens in response to zonulin. Elevated levels are associated with the progression of intestinal permeability. Occludin is essential in tight junction stability and barrier function. Together, both occludin and zonulin are the gatekeepers of those tight junction proteins when functioning properly. They prevent large molecules from crossing intestinal barrier into the bloodstream, where they can elicit an immune response. LPS, there's a lot going on with this bad boy, if you will. Many of the bacteria that holds on the intestinal wall are gram-negative bacteria. These bacteria are pathogenic. LPS acts as an extremely strong stimulator of innate immunity. Humans, it's called an endotoxin. It triggers the release of a vast number of inflammatory cytokines. It can correct a direct epithelial damage in the gut, and it can cause the blood-brain barrier. Some other points of note: it makes biofilm, a biofilm that encapsulates bacteria. It also encapsulates VLDL, LDL, and triglycerides. LPS, as you can see, attaches to toll-like receptor 4. Toll-like receptor 4 stimulates inflammation by stimulating the NF-kappa B inflammatory pathway, which releases cytokines and interleukins. It also damages the mitochondria. I really want to make a point about that, because when people have gut problems, they typically have fatigue. Obviously, your gut isn't functioning well. Damaging your mitochondria will lead you to a decrease in ATP production. So the mitochondria's origin is in the gut. It actually comes from the bacteria in the gut and is a communicator and a sister to the gut, if you will. So therefore, when you have a compromised gut, mitochondria doesn't function well. Mitochondria not only is the powerhouse of the cell, it also has an innate immune system function. It actually eats up bacteria. So the body's fascinatingly all interconnected. Even though the gut has 80% of immune cells, I think it's more potent with immunity because it has an effect on the mitochondria. So once LPS attaches to toll-like receptor, it increases inflammation. Everybody, I did say LPS increases the incidence of cardiovascular disease by 3 times. LPS, stimulating toll-like receptors, stimulating inflammation. Also, toll-like receptor stimulates toll-like receptor 2, which is plaquing. So LPS increases inflammation, it increases plaquing, and it decreases your immune system function and your energy levels by damaging mitochondria. So LPS, without question, I named appropriately El Diablo, the devil. He's a bad boy. Let's break this down a little bit more simplistically. LPS, coming out with gram-negative bacteria, stimulating toll-like receptor 4, stimulating MyD88, activating NF-kappa B, getting to the idea and the increased release of inflammatory cytokines, TNF-alpha, interleukin-1 beta, interleukin-6, and interleukin-8. Systemic LPS is linked to multiple disorders. It damages the joint, the heart, the immune modulation, the liver, the thyroid, metabolic disorders, lung. Without question, LPS damages the brain. Another thing, an unspoken thing, is the release of LPS damages the muscle. So there's a direct correlation between not only the gut in the joint, gut in the brain, the gut in the disc, but the gut in the muscle. So if you're a musculoskeletal person venturing into the idea of functional health, functional nutrition, functional medicine, the gut is where you want to start. But interestingly enough, when you take a good look at this, you have to remember there are 2 pathways that the gut gets ripped on. The paracellular pathway is those tight junctions, which are talked about so much, where zonulin is increased, also expressing the release and the damage in the pull of occludin, and the transcellular pathway, which is through the epithelial cell. So that's something like, I would say, as an FYI. I do utilize this, and if someone has a question, I can go into more detail. I do utilize this with the leaky gut or the gut barrier panel test. Okay, let's see what supplements might help. I believe shaping the gut microbiome for cardiovascular benefits. So you want to use probiotics, prebiotics with probiotics, fiber-rich diet will give you improved cardiovascular health. All of the healthy gut will decrease metabolic syndrome, inflammation, and atherogenic lipid profiles. So I believe in my Super Seminar Action Plan. I'm not going to go into vast detail because in the interest of time, I'm checking my time right now. I want to be able to answer all your questions because I see a bevy of questions there. Number one, you want to look at resetting. My first R is reset. You want to reset your diet, lifestyle, and mindset. It's encapsulated in one sentence. Health is wealth. What's the best diet for everybody? There is no one best diet. It's the diet that works best for you, that's individualized and personalized for you, your patient, your friends, your family. The second R is to remove. Here is where you want to remove unwanted pathogens. Here is where you want to remove pathogens, parasites, bacteria. What you would use is you would use berberine for the lower bowel, oregano oil for the upper GI tract, garlic, which is your natural antibiotic. You would use a biofilm buster. 8 out of 10 bacterial infections in the gut have a biofilm. So breaking up that biofilm, or as I like to say, a formula that's a biofilm buster, exposes the bacteria, and then you come in with something called the mop of the gut, serum bovine immunoglobulins. That'll just mop up that gut, because if you open up the biofilm and leave the bacteria there, you'll have a Herpes reaction, which is just awful. So the dynamic duo, biofilm buster and serum bovine immunoglobulin. You replace, that's the third R, you want to replace with needed digestive enzymes, pancreatic enzymes, and stomach acids. You also want to have the secret sauce. Make sure you increase bile acids by adding taurine and or ox biles. This taurine is a great help for cholesterol modification. Regenerate. This is where you want to regenerate your damaged intestinal mucosa, where you want to heal and seal your gut lining. You want to use a plethora of pleiotropic nutrients that allow for an anti-inflammatory intestinal milieu and also heal and seal the gut. 5, you want to reinoculate with pre and probiotics. Please don't give a probiotic without a prebiotic. You want to reintroduce certain foods. So here's a chance to reintroduce or retest after 90 days. I do retest after 90. If you want to reintroduce, because you don't want to do the test again, you need to reintroduce each food and one food at a time for 3 days. It's a little time consuming. And last, you want to retain your health and your GI integrity. You're going to retain your health and your GI integrity by using a multivitamin, multimineral, omega-3 fatty acid, vitamin D3 with K2, pre and probiotic, and probably a high-level magnesium. I call it the player's choice, but high-level magnesium and or creatine. So let me throw up all the supplements. Here is my Candida recommendations. Here's my Zolney and Occludin. Here's my LPS. I'll give you a second to take a look at this. Incidentally, all slides are made available for you. So the most effective clinical outcomes across all disease spectrums will result from the normalization of gut function. Without question, gut is the epicenter of your health. So I wanted to share a cholesterol protocol. I know a lot of people always ask for cholesterol. So LDL, how would you decrease LDL? Use niacin, omega-3 fatty acids, nattokinase, multivitamin, red yeast rice, vitamin D3 with K2, phytosteroids, and my Super 7R action plan. There's an argument, can you lower LP little a because it's a genetic mark? How does this sound? How about by using a protocol that doesn't allow it to elevate, you effectively lower your incidence? L-carnitine, coenzyme Q10, ginkgo biloba, resveratrol, curcumin, flax seeds, and limpid carbohydrates would be a great choice. You could also combine exercise to decrease your cardiovascular risk. New research suggests the combination of aerobic exercise and strength training lowers heart disease as effectively as aerobic-only routines. Strength training is your choice because keeping muscle mass, especially under the longevity guys, muscle mass is an endocrine organ. You're more efficient with your blood sugar. Blood sugar is one of the biggest reasons for plaquing. Also, elevated blood sugar leads you down a slippery slope of leaky gut. So combining exercise groups have the most improved aerobic fitness and strength.
Welcome to Rupa Health, the best place to order, manage, and track results from over 30 different lab companies in one single place for free. It's going to take you under 2 minutes to sign up, and you can order any functional medicine lab for your client in under 30 seconds. Let me show you how it's done. So here's our beautiful interface. I'm typing in the name of my client, selecting the lab that I want to order for them, and hitting send. From there, Rupa and their amazing team handle the rest. They email the client, collect payment, and even offer an interest-free 3-month payment plan. We've also built the world's largest library of information about chronic health conditions, the lab tests that can help you find the root cause, and the evidence-based interventions that you can use to help people heal from them. It's called the Rupa Health Magazine. There, we have in-depth articles about almost any health condition you can imagine. And we give you step-by-step protocols that other clinicians have used to help their clients heal and that are verified by evidence-based sources. You should totally check it out, and it'll transform your practice. And we can't wait to see you. So make sure you sign up today at rupahealth.com.